ਟੋਰਾਂਟੋ ਵਾਸੀਆਂ ਦੇ ਇਹਨਾਂ ਸਵਾਲਾਂ ਨੂੰ ਸਾਡੀ ਸਹਿਯੋਗੀ ਜਸਲੀਨ ਕੌਰ ਨੇ ਟੋਰਾਂਟੋ ਦੀ ਹੈਲਥ ਮਿਨਿਸਟਰ ਤੇ ਡਿਪਟੀ ਪ੍ਰੀਮੀਅਰ ਕ੍ਰਿਸਟੀਨ ਇਲੀਅਟ ਦੇ ਕੋਲ ਵੀ ਚੁੱਕਿਆ। ਉਹਨਾਂ ਨੇ ਕੀ ਕਿਹਾ ਉਹ ਸੁਣ ਲੈਂਦੇ ਹਾਂ।
Minister, my first question to you is Ontario has reported 223 outbreaks at long-term care facilities since the crisis began. Some GTA long-term care homes are suffering the deadliest coronavirus outbreaks. What efforts government is focusing on supporting those homes and helping seniors?
Well, we have taken a number of efforts over the last number of months, first by restricting visitors and then by making sure that we can monitor who's coming in terms of staff, as well as anybody who's coming in with essential supplies. More recently, we have, because of staffing levels, because some of the staff members becoming ill, unfortunately, we have asked the Canadian Armed Forces for assistance in providing staff in some of the long-term care homes. They have gone into 5 homes where they're supplying nursing, cleaning, and other services to help the people in the homes, first to help the residents and to help the staff of the homes get back into full-scale operation. But we also have changed some of our internal rules to allow hospitals to also partner with long-term care homes to be able to send staff in there as well. So we are supporting our homes as much as we possibly can to get them back on a stable footing so that they can move forward and have their own staff come back into a safe and healthy workplace.
Minister Elliott, just before your call, I was talking to one of the Toronto resident whose dad was infected with COVID-19 and unfortunately he could not survive. She's blaming the government for less help in long-term care centers. She also said the long-term care centers are not taking infected patients to the hospitals, and even after getting the help of the army, they are not able to control the spread of the virus.
Well, I'm certainly very sorry to hear of the loss of this loved one. It's very difficult, I know, for very many families when they're not able to go in to see their family members. But it is something that we are working with the long-term care homes, particularly in the situations where hospital staff are already going in to the long-term care homes. If people are very ill and need to go to hospital, of course, they will be taken to hospital. In some cases, though, they may have a very negligible symptoms that they can be managed at the long-term care home, in which case they need to be put into proper self-isolation so that other patients or residents don't get infected. So I think there's a number of measures that are being taken at long-term care homes to help stop the spread and to nurse the people who do have COVID back to health.
Long-term care home workers did rally in front of Midland Garden Care Community in Toronto on Tuesday. Union representing thousands of healthcare workers is calling for a public inquiry into deaths at homes across the province. What's government response on this?
What I would say is we are taking measures now to deal with a very urgent situation that we know that many long-term care homes need assistance with respect to staff. We are making sure that they get that assistance. We are also having public health work with them in terms of sending in teams to assess infection control protocols and so on. And we are certainly making sure that we are sending personal protective equipment to long-term care homes. They are sending us daily inventories of what they need, and if they need more personal protective equipment, we are sending it to them. So we are taking every step that we can provincially in order to make sure that we do whatever we can to stop the spread of COVID-19.
Minister Elliott, we see that Ontario is planning to reopen the economy slowly, but we see some of the businesses are open in Ontario, and the health officials said that they will observe the cases and will open phase 2 of the economy depending on the number of cases increasing per day. But how the government is monitoring these numbers, also how government is making sure that the businesses which are allowed to open, they are taking proper precautions, they are following guidelines.
Well, first, we are seeing the number of new cases coming in on a daily basis. And so far, the numbers of new cases have started to decline. that is a positive sign. We look at that on a daily basis. So if we start seeing those numbers go up rapidly, then we know that there's a problem with some of the things that we have opened up, and we need to examine that very closely to see where those new cases are coming from. So we're going to take a step-by-step approach with this, and if we go too far too fast, then we're going to see that in the number of new cases. But what we are planning is a very careful, cautious approach, knowing that people want to get back into business, that they want to be working again. But the most important thing is the health and safety of all Ontarians. And so all of our decisions are going to be based on that and that review, based on science and on clinical reviews. In terms of who's going to enforce that businesses are doing things in the proper way, we are really assuming that businesses will do that. And so far, everything that we've seen indicates that people are following the rules, because we just don't have enough bylaw officers or police officers to go by and write tickets and fine people. We don't want to do that, and we don't have the resources to it in any event. So we are relying on people to do the right thing, and I'm very happy to say that the vast majority of the people in Ontario are doing that.